Good evening once again, everybody. Thank you so much for joining us for the Digital Cafe session. It's good to see a good turnout on a Friday evening. A lot of them from the incubator are here. We also have some new people from different colleges today. We hope to hear from all of you all through the session today. So today's topic for Digital Cafe is assistive technology. We have a lot of startups working in IIT Madras MedTech Incubator in this space, and we have some of them online today, hoping to see some good stirred up conversation with them. Before we get on to the interaction, we have a quick poll for today's session. The poll link will be there on the chat box. Requesting you to kindly click on the poll link to make your choices. Over to Harshini to conduct the poll.
Thank you, Pratishtha. So the first question for the poll is, on a scale of 1 to 10, how optimistic you are as an entrepreneur? Kindly give in your answers in the link mentioned in the chat box. Okay, we received responses, so we'll move on to the next question. I'd like to interact with marketing, sales, action, legal advisor, investor. Requesting you to kindly give any answers, please. Yeah, we're receiving responses. Okay, so let's move on. Client action during the pandemic, on funding the pandemic, leadership, or on startup innovations. Kindly give me your answers. So yeah, we're receiving responses. Okay, thank you all. Over to Pratishtha.
Thank you, Harshini. So moving to today's session, assistive technology. We have a couple of our startups working in the assistive technology space. Today we have with us Professor Ramki and Praveen, who will be talking about their experience in developing an assistive technology. So maybe Professor Ramki can sort of give us a brief about iMove Motion Tech. He's the founder of iMove Motion Tech and also faculty at IIT Madras.
Hi everyone. Thanks, Pratishtha. Okay, I don't have a presentation, but I think that's okay.
No, this is not a presentation. Just a quick introduction about the company, Prof.
Okay, so we are into assistive technologies. Specifically, we make devices which will monitor human walking or any of those motoring actions. And in some cases, we could also provide corrective treatment for people who are affected by strokes, or could also be extended to things like Parkinson's disease. We are also currently working on rehabilitation using virtual reality-based techniques. Also looking at things where you can incorporate advances in technology like digital twins to see if you can predict certain things in human motion or any kind of motoring action, which is one thing that the geriatry division has been interested in for a very long time, with no concrete answers or even or results with very less accuracy. So okay, we have been into this for about a couple of years. Like okay, so I'm faculty, so I devote like a bit less time towards developments in the startup. Of course, the current pandemic, everything is on a standstill, because this was a time where we were about to start large-scale clinical trials, but then all the hospitals have different priorities now, so we couldn't do that. And also, I do not know what the investment scenario at the moment would be like. So I don't know, Pratisha, what kind of things you would want me to share as an academician or as a half entrepreneur or something like that. So I can. So anything specific you want me to say, I can say that.
Sure. Thanks, Prof. We'll have a lot more questions from the audience, and also some questions that we already have collected. Before that, we'll also hear from Praveen, who is Praveen and Gayatri, who are founders of Dextroware, and they developed something called Mouseware. Praveen, do you want to give a brief about Mouseware, what it does, and how you guys are creating social impact?
Yeah, sure. Thank you, Barista. So, hi, this is Praveen here. We are new to HTIC family. So, a short intro about us. So our startup will be a single stop for development of extremely affordable assistive technologies. So the first assistive tech we have lined up is, we named it as Mouseware. So we know that people who are unable to use their hands, or people without hands, because of unfortunate reasons, cannot control and work with computers or with any smart devices. They need hands to perform mouse and keyboard operations, of course. So our device will be a solution for them. Ours is a hands-free headphone structured device that comprises multiple head tracking sensors. So using the device, it is enough if they just rotate their heads in the corresponding direction to control the mouse cursor on the screen. So for example, to move the mouse cursor to the left, the user just has to slightly rotate his head towards the left direction. And also we have no other mouse accessories. Let's not get too technical. So this is a short intro about our device, and yeah, we have other assistive technologies on our mind, which will be taken out in the future.
Thanks, Praveen. So we also have another startup, Kriya Neuro. I think Dhanush and Bala both are also there. Would you like to quickly give a brief about Kriya Neuro, Dhanush or Balmurkan? Any of you?
Yeah, hi, Pratishtha. So, good evening, everyone. So, can you all hear me?
Yes, Dhanush, we can hear you.
Yeah. So we work on actually providing solutions for people with movement disorders. Such as movement like dyskinetic syndromes like Parkinson's disease and speaking disorders. Speaking disorders. So the people who have this problem of giving a proper speech output, and who have a total speech loss, we are providing them assistive solution in that aspect. Towards the COVID, we are also getting a few inquiries for people with COVID who are not able to speak, because when there are people who have this problem, like when they speak, they spill out saliva and stuff. So we got few inquiries from those people after they went through our website, asking for some speech assistive solutions. Since we are locked up, we told like it is actually not possible at this current stage, but we are getting some inquiries. So post lockdown and stuff, we might be looking into some kind of a growth in that aspect, where so they can just communicate with just a press of a button. They can communicate the basic needs to their near and dear, so that they're communicate. So they don't need to use their voice. When they use so by this, the spread of the disease can also be contained. So this is one direction we are currently looking in post COVID. Before to this, we are providing the assistive solutions in the directions of speech disorders and movement related disorders. Yeah, that is the thing, Pratishtha. So, anyone have any on that?
Yeah.
Yeah.
Any questions from anybody on the 3 startups? Any questions? Okay, so the usual challenge that most assistive technology startups face is that they are usually very deeply technology-driven startups, but however, getting their market proposition right is very important because they have multiple stakeholders involved in their startups. They have because it's not an OTC, over-the-counter sort of a solution. So they have hospitals and doctors and neurologists and neurosurgeons involved. So what is your take on that? How are you managing moving to the commercial part of it, Prof and Praveen and Danush? How are you guys managing that?
So hello, this is Praveen. So what I say is that assistive technology is something that helps people work around challenges so that they can learn, communicate, function better. So it is any device, it can be as simple as any pencil grip. So assistive technology is something that helps, that makes a person's life easy. So what I say is that why not, we extend our device to a normal people. So if taken, in our case, it is a head structured mouse. I mean, headphone structured mouse. So it can be actually be used by anyone. No, a normal person like us can also use our device. No, it makes it prevents the problem of carpal tunnel syndrome. So, so I say like this.
But in Praveen, in your case, do you have to get does it have to be prescribed from a doctor, clinician, or in specific, or it can be over-the-counter sort of a solution that can be taken by anybody?
Yeah, actually, I spoke about this with a couple of doctors, and they very much welcome our device. No, I mean, of course, they have to prescribe it, but they are strongly suggesting to use a device for people who are suffering from the CTS.
Okay, okay. Professor Ramki, what is your take on this, Prof?
Okay, my take of this, I'll say, there are a couple of assistive devices, 2 categories I would broadly classify. One is which you can directly buy off the shelf, like a hearing aid or something which will assist you to walk, like some kind of fancy crutches or those fancy wheelchairs or anything that will make you maybe lift a glass of water and so on. So these are things which are available off the shelf, and these are possibly easier to market because they have been standardized and all. So which is directly like from the business terms, is more like a B2C model. However, what we try to do is more like our assistive technology is more a part of the treatment and the rehabilitation process, for which we have to collaborate with doctors and hospitals, and so which will fall into the category of B2B model, which I think even Mohandas Pai yesterday was saying that is in some sense kind of a risky business of us to deal with hospitals in a B2B model. But the kind of things we want to develop or we envisage, they broadly fall into the category of B2B. Eventually, we could have some devices as a result of our some kind of byproducts which could people could directly buy off the shelf and kind of use. So I think so we are currently to that model where we cannot sell it off the shelf to customers directly, and that possibly is a big challenge for us to even attract investment or even like grow big within the next few years. And that is where I think is our biggest challenge at the moment.
Right. Yeah. So, Prof, just a follow-up question. So, you must be you're already in the phase of validating your technology. So, yes. So at this point, how are you managing the validation process?
Okay, so there are a couple of things here. So, for example, if I look at IIT, research and development is an integral part of the campus setup. This includes extends to even private colleges. Whereas if I go to private hospitals, R&D is not their priority, or it doesn't even fit into their scheme of things. So The challenge is to get doctors who would collaborate with us. So we now found few doctors who do it things for personal interest, and there are a bunch of them, right? So who understand a bit of engineering and who think it is worthwhile to invest in alternative technology. Otherwise, most hospitals are just happy buying stuff from outside and then kind of treating as many patients as possible to maximize the throughput. So that support from hospitals is, and because we are not into the big business is in hospital automation, where you can say a doctor is attending to 10 patients per hour. If you can make it 100, then they will be really happy to do that. That more from the automation part of the entire process from when a person steps into the hospital till he is discharged. But we now at the moment work on personal contacts or through some NGO kind of agencies who have patients who need treatment, who possibly cannot afford something imported from the US or China for that matter. So I guess that answers that question. So the validation is mostly through NGO kind of people and through personal doctors who are personally interested in this kind of advances.
Yeah, thanks, Prof. I think even Kriya Neuro is in the process of validating and sort of reaching out to hospitals. So how are you taking through the validation process, Dhanush?
See, Pratish, actually, let me introduce. Like we are currently focusing on two products.
Two products, correct? Yeah.
So one is Parkinson's disease band. Another one is so that's a monitoring solution that we want to provide to people. Another one is the speaking glove speech assistive solution. So if you see the first product, actually it cannot be sold directly to the consumer. It has to go through. It has to be prescribed by a doctor. So so it actually it gets itself classified into a B2B market. While the speaking glove it is assistive solution where it can be used directly by the consumer for their need. So so it is just going to help them come out of their challenges, what they face in the day-to-day life while communicating. So so what we thought, so based on so we have performed validations, that is we are awaiting clinical trials for both of these products. So as of the lab validations are concerned, we have done validating the Parkinson's band recently. Speaking glove, what we have done is, so speaking glove actually is an extension of my PhD thesis. So the validations of its basic functionalities I've already performed in my in my PhD when I was doing PhD. So now it actually requires what is clinical trial. So these two products are in the stages of clinical trial. And we have got, actually we have also spoken with the clinicians and the people. Here what I say is a speech therapist who actually use these devices and prescribe these devices. So in the past 1 or 2 months, when during lockdown, we spoke to almost like 40 to 50 people who want this gloves, such as clinicians, patients, speech therapist, the audiologists. So we spoke to everyone. We as a team of Kriya Neuro, we spoke to everyone. We got their inputs, and we have we were able to validate that their needs actually or equated by our devices features. So these are the things that we are currently doing. And as of next stages, that's concern. What we are planning to do is, since one of the products can be sold directly to consumer, we hope that we can make some kind of funds out of that and then rotate it to bring the another product that's Parkinson's band into the field. So that's what we are actually looking in. Because the B2 the speaking gloves as such is actually the people are asking, when they see the website, they are asking for such devices, because with the device actually you can extend the device so that without even needing to, because mostly now people use are actually working from the home, use their keyboards, right? So there is a problem of spreading in that also, because they have to type it. So with this device, we can actually provide an extension where they don't need to use the keyboard. So they can just use this glove to type whatever they want on the keyboard, and it can be sanitized as well. So these are some things. So that was my thesis work. So now I have extended into a speech domain. So these are few things using which we can actually pull in some funds into the company and bootstrap it into for Parkinson's band to take it to the market, because that's a bigger route, because it has to go through a doctor and it's a B2B chain. So that's the plan we are thinking as such in the current scenarios, Pratishtha.
Yeah, thanks, Dhanush. I think it's great to see how you've converted your thesis to something more commercially viable. Also, how you're looking at opportunities in this crisis and using contactless devices for solutions for COVID as well. So I'm going to take a quick break here and ask if there are any questions from the audience. Please feel free to ask questions. I think we have a question from Sundaram Shankaran. Please go ahead and ask your questions. You can unmute yourself and ask. This is a free-flowing conversation.
Great, thank you. I am very new to this, so I'm just participating to try and get my bearings here.
Sure, no problem, sir. Please go ahead.
So I have always had this question, and I'm not sure I haven't had an opportunity to ask anybody this. The startups that have these ideas may not have all the talent to put a prototype together in terms of maybe the hardware. So how does a startup go about creating the first prototype? Do you use some sort of professional services? Does the incubator provide that? So that was my question.
Okay, this is Muthu from HTIC. Are you part of any incubator right now?
No, I don't have a startup yet. I'm kind of in the idea stage, I guess.
Okay, it's probably a good time to talk with one of the team members at HTIC. We also provide a 3 to 6 months pre-incubation where you can work all these things out, and my team down at HTIC will be able to help you get to do that. And also we have 60 to 80 researchers working on different areas who can help you initially, not on full-time basis, but they can give you advice how to go about building your prototype.
I see. But is this the general scenario? Is this how everybody does it? That was my general question, I guess.
It depends. If you are like Professor Ramki, you don't need an expert to teach you. He's an expert. So someone like me, I'm not an expert technologist, but I can connect to the market. So then I'll have to go to somebody like, I'll need to go to somebody like Ramki to get the technology. So everyone has got their own way of doing stuff. But the first thing you can do is drop a mail to Regista, the one who's hosting the program. Email she's just posted. Drop her a mail, tell her what you're planning to do, then she will guide you from there.
Great, wonderful. Thank you.
So that is something you can do. But just I see a couple of new faces are there. My friend Mohan Narayanan is there. Maybe you get him to say something.
No, I just sorry, Muthu. Thanks for recognizing me. I logged in because
I always recognize you.
I logged in because Praveen and his team.
He asked me. Yeah. So please. So we do this every Friday. We make it like a free flow conversation, just so the startups don't feel lonely and stuff like that. So
no, it's a brilliant idea, Muthu.
It's not. I mean, earlier we were doing little presentations. We felt this week will change it more like because originally the idea was to have a conversation, not presentation, but it went the wrong way for a couple of weeks. Hopefully, we are correcting it now.
Sure, I'll do that, and great to connect back with you. And Pratishtha, I have not seen her for ages, but Pratishtha, hi. A long time you're not met, but hopefully you'll meet sometime soon.
Sure.
Hello, sir. How are you?
Good. How are you?
Good, sir. Good, sir. Thanks for joining us today.
Sure.
I know that you have one of your mentees also online, so I think that was the motivation.
Yeah, Praveen and his team, I've been kind of trying to help them for a while. We are still trying to, get some of the rough edges worked out. So need a lot of feedback from everyone, to see how this can be taken forward.
Yeah, but just one of the things we can do today, there are people here, they can talk about their startups as well, so some of them can maybe say what they're doing.
Sure, yeah. So I see a lot of our startups online. While we're still talking about assistive technology, we can have a quick introduction by some of the startups who are online. I see Jilma, I see online, I see Mr. Gyana Krishnan also there. Maybe you want to unmute and quickly brief what you're working on. So this also will give you a good community chance to interact with other startups at HTIC.
Hi everyone. This is Jilma here. Very nice, interaction that is going on here. So I always look forward to this session. It's like nice to chat with single-minded people. Talking about my company, so our company's name is Osmosis, and we are not in resistive technology. We are into cancer screening. So what we do is that we are developing a device that can detect cancer from X-ray spread. So we have developed the prototype and we are in the clinical validation stage. And I have recently pre-incubated here. And, so I find it very helpful. All these mentoring sessions and talk, like very helpful. Yeah. Thank you.
Thanks, Jilma, for introducing yourself. We also see Mr. Gyana Krishnan online. So would you like to quickly introduce yourself and what you're working on?
You have to unmute first.
So you have to unmute to speak, sir.
Okay, while he figures out how to unmute, if anyone is here for the first time, can you introduce yourself as well, please? Anyone here for the first time who's come? I see a couple of names there which I don't recognize, so maybe you can ask them. Okay, producer, if no one...
Okay.
Carry on.
Okay, so the next thing that most people sort of face in terms of getting their solutions commercialized is adoption. So while we know that two of the startups are already working to get their solutions validated, clinically validated at several hospitals, and Praveen is still at early stages and getting his clearance for validation. So maybe you want to tell us how you have actually taken the validation part and how you actually gotten some customers on board, Professor.
Okay, so I should talk about customers.
How have you actually gotten those customers and what is the strategy, adoption strategy?
Okay, so we at the moment do not have direct customers who have from doctors. However, we had some interest from the National Aerospace Laboratories in Bangalore, which bought 3 of our sensors. For some reason, so they were spending a lot of money in this gate monitoring devices. Possibly it was required for some of those their trainings or something. So they should spend 10 times more. So our first sales was a non-doctor sale, non-hospital sale. We sold to a government research lab, and then we provide some kind of services to existing technologies like for example, we did something for the very famous standing wheelchair project, which is a big hit from IIT Madras, and a couple of other interests where we are looking at providing some kind of a monitoring service not as a product but more as a service. So in the future, I see is that we will be like a combination of a service plus a product model. So at the moment, our target customers still are still like experimenting or evaluating our product. But we did make little sales, which kind of adds I think to our CV.
So, sir, you're also getting your solutions validated at multiple hospitals like SIMS, and so Would that be like a strategy to pilot your idea and then see how it goes forward? How, I mean,
Yes, yeah, okay. So here also this gentleman Sundaram asked a question also, right? So how does a startup go about making a prototype? So I'll start with that process, right? So most of the people like engineers like us think a small lab experiment is already a product. But so I think a lab experiment is okay, but to prioritizing that needs lots of real-time testing. You have to follow certain standards, certain ergonomics, certain design standards. Especially if you're into wearables, it should people should be it should be attractive enough for people to wear that. It should be small. It should again not look ugly and all that things that come into mind. So okay. So now back to this marketing. Our strategy is to first to go with doctors who are dealing with the kind of our kind of target patients, and from them, if then doctors is like a big network, right? So I mean, I've met the doctors somewhere who actually heard about iMove not through me, but some other doctor, maybe from SIMS or CMC Vellore, who those doctors are collaborating with. So the kind of the spread of the information is rather fast. Just that we should be like active enough to get our product validated, and we should spend a lot of time in that. So sometimes it's just like you should work 7 days a week. Sometimes the patients may not be available, doctor may not be available, but you should be available whenever the doctor or the patient is available. So the strategy works through the network of doctors at the moment. I'm not talking yet about how to attract an investor, but currently the strategy with doctors seems to be moving forward. If not for this this big lockdown due to the pandemic.
thank you, Prof. I think you've answered even Sundaram's question and also this question. I also want to ask Praveen. Praveen is just out of college and he's just graduating, and he has already started his own startup. So Praveen, we want to understand your motivation. You're really young and you've not really looked for placements, and you've come up into this space, medtech, which is like quite. The gestation period for assistive technology or medtech is quite high. So what actually motivated you to get into this space?
Yeah, thank you, Pratishtha. So yeah, as Pratishtha said, I did not attend any placements. So actually, as a classic engineer, I created the product first and then searched for the market. So to get the preliminary testing done, we attended a workshop conducted by Massachusetts Institute of Technology here at Tidal Park. So it was named as Co-Create. So what they did is that they brought in many differently able people, people without limb function or people without eye vision. Yeah. So what we did is that we took our Bowsware version 0.1 to that workshop and they had the preliminary testing with them. So responding to Mr. Sundaram Sankaran's question. So I think pertaining to assistive technology, the best way to invent something is to sit with the assistive, I mean a differently able person, and get their feedback, and then simultaneously it's a one-on and hand-to-hand process. So I think this is such like thing, and just a second. Yeah, hello. Sorry, lost you for a second. So
Go
yeah,
ahead, Praveen.
So as I said, I think I have some connective issues here.
Praveen? Okay, while he fixes, I think we have a question on the chat box. CEC and Gopi J. Do you want to ask your question? I think you'll be able to get some interesting answers. We have a lot of engineers on board, Gopi.
Yes, sure, madam. I am Gopi. I am studying this nursing. I have students from Chetnad College of Nursing. I have designed some prototype and I have some ideas. How to that idea will be converted in a market to commercialize the prototype into market. Can you give some ideas, sir?
Prof, do you want to answer?
Yeah, madam.
So I think the incubation managers can tell you about commercialization, but what I would look at is, okay, is like who do you want to sell this? Okay, I don't know what your product is. I mean, most ideas, of course, are enough.
Sir, I have designed some gloves.
Sorry.
Gloves, sir, gloves.
Yeah.
I have designed gloves.
Yeah. So.
It's not fully completed. I have designed the early prototype, sir. It has some negatives that how to success that prototype. Can you give some expect to how to that product will be no more negatives and will be a success? Sir.
Okay, okay, I'll say very few things, but then I'll pass on to Pratisha or Muthu, who will be better. So I don't know. So the thing called prototype is I think what most people like us, right? I mean, including me, they confuse a proof of concept for a prototype. So so what you have is now, okay, you may have something which you think is exciting, but the first thing is you should actually talk to people who will tell you if, or you talk to the buyers, right? It could be doctors or whatever, who find it interesting. What we experience from our thing is that once we go with some working model, the doctors will have their own set of ideas to be incorporated. I say, okay, I can measure parameter X. He will say, why not Y and Z by adding one more chip, or why can't I do put it one here and one there? So they'll come up with their own lot of ideas. So a prototype would be something which is which is ready to sell, which has a lot of inputs from people, which has maybe passed the quality test, passed the standardization tests, and also if it involves the medical trials or patient testing, then it should go through those proper channels. So I think Pratisha should be able to tell you better on this thing about prototype and how to be successful. We are looking forward to her to give us some inputs on this.
So we have another mentor. Maybe Mohan sir can answer that as well. So he's looking to get an answer on how we can iterate his prototype.
Improve the yes, ma'am. How to improve the product to be success.
Correct. Yeah.
Can you speak up? I couldn't hear you. Can you ask that question again?
Yeah. So his question was. So he's already designed a prototype and he's looking to iterate it to make it successful. So what are the steps, or how can he do that?
So, okay. So if I can ask you a couple of questions. So who is your proposed customer?
Medical doctors, sir. Doctors and nurses, sir, who are using the gloves. Sir.
Hey, you'll have to speak up a little bit. Be a little more louder so I can hear.
Sir, the ideal customer is doctor and nurses, sir.
You need to speak into the mic, Gopi, I think, because even I can't hear. So unless Mohan can hear, he won't be able to respond. So just
yes, sir.
speak into the mic.
My ideal customer is doctor and nurses, sir.
So you will have to first talk to them. See, do you have the first version of the prototype ready? I mean, I don't know what the product is, so I'm asking some, blind questions. But do you have the prototype ready?
I have some negatives, sir. Some disadvantages is there, sir. How to rectify, sir? I need some expect to how to improve that product, sir. I have designed, but some disadvantages is there, sir.
Okay, I couldn't hear you, but what you're saying is you have a product, but you want to improve it.
Yeah,
so
yes,
you
sir.
want to know
sure,
how
sir.
about it, right? Okay.
Yes, sir. Sure, sir.
So how do you know it needs improvement?
That's my negatives. I have some negatives. I designed the product. That product is not fully successful, but it has some negatives, sir. That I realize now. I realize that negatives, sir. So how can I rectify that negatives, sir?
Okay, Gopi, can I suggest what you can do? Why don't you write just an email with what you are doing? We will take a look at it and see how to help you. Because without knowing what you are doing, it's not going to be feasible to answer. So the first thing you want to do, I think one of the things for those of you who don't have an incubator attached, that's something you should do first. Because like the HTIC incubator has a whole lot of resources which you can access.
Okay.
So I think drop an email to Pratisha, then she will know who to connect you. Maybe Professor Ram.
Can you give your number, sir? I will talk to you, sir.
Gopi, I have dropped my email address. It's community@htic.itf.ac.in. You can write to me and I can take you through the process.
Okay, madam. Thank you, madam.
Okay, thanks, Gopi.
Okay. Thank you.
So before,
So
yes,
Pratishtha, can I
yes,
interrupt you
Dhanush.
for a moment?
Sure, please go ahead.
Since Kriya Neuro also we are doing something very much close to the gloves. So can I ask just one question to Mr. Gopi? So is he online? So Gopi,
Yeah.
can you hear me? Gopi, only one thing, one clarification, just a small clarification. So what is the purpose of the gloves? So if that question is answered, then most of the queries what people in the group
It's a
ask
low
can
cost.
be easily. Yeah, it's a
low
low cost.
cost, sir.
Okay, for what is the purpose for it?
So normally in medical field, all are using gloves to prevent the infection, sir. For surgery, for dressing, they are using gloves, sir. These gloves are some already in current market. Our gloves have some negatives, sir. They take more cost, and they have a long process to manufacture.
So
that I made it easy to make a glove. So that's my idea, sir.
That's good. That's good, Gopi. But one question is so now currently people use this rubber gloves. I mean, they use what I have seen. I have seen surgery. I mean, latex gloves they use, right? So what is the in the sense what advantage your product is going to give? So how is it going to prevent the spread of infection? I guess that is the key point that you are trying to address, right? You wanted to reduce the spread of infection, right?
Yes, sir.
So the people will be using this to handle devices, is it? So handle in the sense touch it, touch the devices. So just like how they use the latex gloves, so they will be using your glove to basically touch. I mean, they basically use to work on with the day-to-day activities. Correct?
Yes, sir. Correct, sir.
Okay, so so as people told, you can drop an email to Pratishtha. But one thing what I wanted to suggest is, you know what is so how we have come up. So we do something called gloves in our company as well. So what we have done is basically we have done the field testing, and then we have asked people to use this glove and got the readings or got some measure out of that performance measure of the glove, and then we validated our system. Okay, so how it's good for them to use, how the performance. Let's say mine is a speaking glove, right? That's what I've been telling. So how audible, how performance, how it is basically audible to the people, and how easy it is, how quickly they can communicate. What are the errors that they make using this glove? So these are some performances with which I validate my product. I mean, our product. Sorry. So with which we validate our product, and then what we do is so you told no some negatives. You are saying that how to improve the negatives. Then we'll basically see what are the negatives, and as people told in the meeting. So it is up to the customer. What is their need? So their need is basically you have to satisfy their need, right? So if their need is not satisfied, then it's a negative in your product, right? So then you need to address that. For that, you need to go and speak to the customers. Who is your, for example, clinicians, right? You need to go to them. You need to give them a trial or give them a free product or something, so that they use it and they get satisfied, because this is what you build a trust right now, right? With the clinician, and so that you can sell your product. So it's something a huge as people told, you can drop an email to Pratisha. She knows to connect to people. So this is my suggestion, just a suggestion. So you can that's the thing, Gopi, and all the best with your product. It looks very good at the current scenario. Thank you. Thanks. That's it, Pratisha.
Thank you.
Thanks, Dhanush. I think Gopi, you've gotten your answer that you need to sort of give it to some customers, identify your customers, give it to some customers, and then get their feedback to iterate it. Okay. So one of the critical things in assistive technology is also the regulation part of it, because it also involves a lot of clinical trials, and it has a long process involved. Professor Ramki, so how have you actually gone through the entire regulation affairs that are involved in getting assistive technology validated or regulated?
Okay, the electronic things are all easy because we could get it done from HTIC. So somebody from HTIC actually helped us with. Uh, but with the ethical clearances and all, I think so. Once we go to the hospitals and do trials or all those things in the hospital environment, the hospital, they have their own framework to take care of these things. But I cannot do it in my own lab or at HTIC because I do not know what the regulations are, and I am possibly not even authorized to do. So much of it we follow through the hospital procedures from the ethical clearance or those patient testing point of view. But for everything else, I think there is standard electronic standards which we need to follow. Standards for medical devices. I think these are pretty well documented, and there are also people who would get this certified for us. That's I think not too difficult to get done.
Yeah, thanks, Rob. Any other view on this from Praveen or from Dhanush? We also have a question on the chat box from Sudha. Maybe we can take that after we answer this question.
Yeah, so as far as our device is concerned, no, it is not going to inject something into the user skin or something. It's just non-invasive. So I've consulted with couple of experts in this domain, and they have they had the insight of our product, and they said that no big no certification is required for this, but yeah, some ISO 6521, I guess we need that certification alone. But I think, as Mr. Ramakrishna said, our product is also electronic based, and no, it can be easily done.
Okay. Dhanush, how about you?
Yeah. Just to recollect that we have two products, right? So these two products are the discussion is about assistive technology, So our product actually since an assistive and it is a monitoring device, and our product is a wearable one. So our thing basically falls under class 2 and type 2 of FDA regulations, as well as the Indian regulations, which is governed by the Cosmetics and Drug Act, So ICMR also. So based on these regulations, what we are able to find after go through them is we have a type 2. Our device falls under so class 2 and type 2 of classification. So which is actually wearable, but the minimal risk. There is no risk involved to the patient. But as the previously told, since it's an electronic device, we need to go for this IC 6060. That's one regulation is there. So we need to show that this device doesn't produce any shock or any fibrillation to the human body, right? So those things we need to provide. So all this process has to be done once you get your clinical data. So based on so our products have completed the lab validation and normal. We have given this to people who in the lab. So people wear it. We test it from the normal people. We got the data and we have done those things. But it has to go through actual population, clinical population. So once it is done, we have to go to the regulation. So this process, after let's say the lockdown is complete, once like a month or two, you go and reach the clinic, which is actually a tough right now. A month or two you take to complete this. After that, it approximately takes. This is what, because I went through a few of those regulation standards. They told like it takes some 8 to 9 months for this to complete. That's the thing. So once you get completed, basically you can export it. FDA is there. Then once you get any of these two things, getting European standards, and the European standards also becomes an easy task. Easy in the sense that they will see the existing certification, they'll go for it. So these are the few things which I was able to understand about our product, our product which we are focusing. So that's the thing, Pratishtha. So
thanks, Dhanush. There's one question from Ms. Sudha Subramaniam. Please go ahead and ask the question. Sudha? Hello? We have another question from Yash also. ISO 13485 is mandatory for CE application for medical devices. Yash, is that a question or a statement? You are on unmute. We can't really. You can unmute yourself, Ms. Sudha. Okay. Okay. Thanks. Thanks, Yash. I think that was a statement. Okay.
Hi. Meanwhile, can I ask a question?
Yeah, please.
Yeah. So we also have been, going through this, initial regulatory things and all. So here, so I'm currently in Pune. So here, what we had done is that we, get ethical committee clearance from hospitals, research, clinical research committee. So, quite a lot of money is involved in that. To have this ethical committee, review your application, you have to pay some fee. So I just wanted to know, have you ever faced such, paying them to have the ethical committee review your project, or is it like free of cost there, wherever you have been doing research? So my question is to Professor and not able to get the other name. Yeah. Hello.
Yeah. Jilma, I think your question is well received. Prof and Dhanush.
Yeah, Dhanush. Yeah.
Yes, sir. You can carry on, sir. Yeah.
So you carry on. I didn't quite understand that question. So you can carry on, sir.
No. Actually, I also wanted to ask that only, sir. Actually, I was not able to understand the question. So, ma'am, can you just shall I rephrase it? So, is it what actually? So, you're asking what are the procedures for ethical approval? So, when I basically
no. So, ethical committee approval I've got. So, what I was telling is that here, if you want to get an ethical committee approval to review your proposal, you are supposed to pay this committee some amount of money. Only then they'll review your proposal. So that is, all these private organizations, private hospitals who are having their clinical research thing, they demand some money upfront from you. And they also charge for, if they're recruiting one patient, you have to pay them some money for that also as well. So have you faced anything like this?
Yes, actually, ma'am, here also. So when we are trying to bring in people, for example, we want to bring in people for clinical trials, right? So prior to that, when we actually went and spoke with the clinician and people from where we are going to get the clinical trials done, so they told like, we need to facilitate them some remuneration, ma'am. So that we need to pay from our side. At least they told when we had a discussion, they told at least you need to provide for transportation and for the convenience and everything. So actually, we wrote a proposal, and one of the major hits was for clinical trials. So we need to support the people who actually taken. And that's the thing, man. So we have actually we have some heads on which we have accumulated from we have reserved some funds especially for to giving for the people. So so and we actually what we do is since I've directly come from a lab. So what we do is we do this subject power analysis actually. So how much subject is actually needed for your for your hypothesis to be tested. So we do the subject analysis. So for example, I give my alpha values, beta values for the given percent of population. So what I expect and everything. So based on that, what I will derive is how much number is basically needed for me to get a power of 95%. So that's actually an I number. You can also set it to 80. So based on that, I set the number. Let's say n equal to 100, and I need to pay for each patient, let's say 1,000 rupees, which is actually at the higher end. So then you can put it 1 lakh or so something like that approximately. That's how we have come up with these calculations, and that's how we actually plan this fund. So that is the thing, ma'am. Yeah.
Okay, so so this, the number which you have come up with, so does the ethical committee ask you to get it reviewed by a statistician, or you have done it yourself?
Yeah, actually, it is the review committee actually asks. So, for example, let's say we are doing with the MMC. This is a government hospital, government college, and government hospital in Chennai. So what we do is, so we have asked this. So it is like two things. So you need to get the ethical approval in the college. I mean, in IITM RT. I mean, in the IITM. As well as you need to get it from. So you need to go through that ethical clearance, as well as you need to get it from the hospital. So when you so you need to have the two-way street, because you're going to you are doing something here as well as you're going there, right? So because when you come here, people will ask, have you got an approval from that hospital? So and you need to get a clear cut. For example, I'm saying no, n equal to 100. So I just arrive it based on our statistical results, but that is not sufficient for ethical. The ethical actually people what we have faced is we actually see whether this is even correct, because it deals with human people, right? Even though you don't inject anything or something, it deals with human population, so they see everything. So they see like why do you need even 100? If you are taking 100, you need to pay this much. Do you have funds? Can you do that? How are you going to even do every question they will ask, ma'am? So these are the things we have faced actually. Yeah, that's the thing.
Jilma, has that answered your question? We have another question from Ms. Sudha. It's already 6 o'clock. We have a small quiz.
I just have a small suggestion. Whenever he's done.
Yeah, ma'am. So I'm done. I think I'll connect with Danush personally, and I'll ask him.
Okay. Now, this is just a suggestion, and to those who are manufacturing gloves and all these gears that are required for the present pandemic and so on. Okay. So the safety and other things everyone is thinking of. I think one of the things that you can think of is for the person who is also wearing it. Of course, that's also safety. The safety to the to the patient and also to the caregivers. They are wearing it for much longer hours than before. Like, for example, if a doctor needs to go for a surgery, or if there is someone who needs to give some care, they used to wear it for a shorter while. Whereas now they have to wear it for a very long time, and what happens is you can see that their skin and everything shrinks after a day's work, right? If you can just think of that. So what I'm trying to say is, please also look to see what are the materials or what is the additional value add that you can do to see that you give a little comfort at this, not compromising on the safety. Is this something that you can think about instead of just cost and other things? Think of this also. Another thing I want to say is also, apart from the caregivers, you do not know when the children go to school and other things, they may also be asked to wear some of these things. So is it that you can think of the various segments that will require this, right? So this is a suggestion I have that I just wanted to say. Thank you.
Thank you. Thank you, ma'am.
So yeah, just one thing. To just answer to ma'am. So what ma'am was saying is like we are trying to do that, ma'am. Actually, so since people are using it for a long time, sweating was a very big problem that we were facing, ma'am. So and because of that, so we are just looking into that, ma'am. So as you rightly suggested, we are looking into that issue actually, because now it has to be taken for a longer period of time. Because when we are conducting experiments itself, which was almost like an half an hour to 1 hour, some people were having this sweating issue. So that's actually a problem, and we rectified it actually using a specialized cloth. We rectified it, but when it comes to a longer period, we are also searching for a solution for that. But we will do it, ma'am. As engineers, no, we can do it. But that's a good suggestion. Thank you, ma'am. We will incorporate it. Yeah.
Yeah. Also look at what you can do for the younger group, because that is something that will also make a lot of commercial sense, because when it's children, people will spend, and the pandemic, it doesn't look like, immediately there can be another time and things like that. You need to be careful for for a longer time. So
Okay, ma'am.
just a suggestion. Okay. Thank
Yeah,
you.
definitely, ma'am. Definitely, we will look into that, ma'am, because we are actually looking into opportunities to put it very clear. We are looking into opportunities to raise funds, ma'am, so that we can just rotate it, bootstrap it, and come up. That's the idea we are looking at. We'll I will take it up, ma'am. Thanks, ma'am. Thanks for the suggestion.
Yeah, another thing, just to add to that, recently there has been a research. They said that it is actually affecting the feet. Okay, you can do some read up about it, and if there's anything that you think ahead of time that you need to do as a protective gear for the legs, you can think of that, because that is something which is being discussed quite extensively now.
Okay, ma'am. Okay, ma'am. Okay, ma'am. Thank you, ma'am.
Praveen, you had something to share?
Yes, Risha, thank you. So my statement is assistive technology as a space is underserved in India. Now, while talking about this B2C market, products available in India has been primarily developed in the Western world, where affordability is not a criteria. Now, in the West, assistive technology products are sold directly to the users to retail stores or through websites. Now, can we follow? No, can this be followed in India? Will it work? I request the audience to shower some views on this.
The Praveen, I was not able to get that answer my question. Like, so you're saying, can you just one more time? Sorry about it.
Not
The
a
question is
problem.
not clear. The question was not clear,
Yeah,
please.
yeah. In the Western world, no, they are selling this assistive technology directly in retail stores or in through websites. Is this possible in India? No, where the affordability is a big criteria here. Is it possible in India for the B2C market for assistive technology?
Actually, my opinion is, see, the Western market is actually a totally different world when compared to our market. Because when we enter into, so our based on my approach when I speak with based on my opinion when I speak with customers, so everything comes into play. At last, it goes to the price tag of what you pay. But when you go to the Western world, no, even if it provides you value for more, like let's say like 3 or 4 times the existing solution, they are ready to go for it. But here there is a trade-off. Our people, and this is what I have seen. There will be so many questions, and at last, what I've understood is the approach that we need to take for Western world is different from what we need to do for our world. So we need to first, what I understood is based on this few months of conversations and stuff, what I've understood is you need to build the trust. You need to basically the general principles of management. You need to build a brand. So building that brand is not easy. So that's what we need to do. And as startups, we need to do that. That's not an easy task. We need to sit when we need to reach to them. We need to convince them. We need to tell them that this actually solves your solution, and we need to show. And we actually, rather than telling them this solves your solution, what we need to do is we need to understand their problem right first. So that's where we are. I was lacking at first. After this few months of lockdown has taught me so many things, like how you need to understand the problem. Then you bring in your solution. Does your solution actually solves their problem? If not, we need to value add our solution. We need to provide few features that will actually address their problem. So why I'm saying that is, people see all many things in Indian market. When you go with a product, or even when you go with something. So I'm working in this. There are so many questions. At last, it goes to the price tag and everything. And but people there, when you basically tell them this is the value that you are going to provide, they are ready to, because I had a few customers. I spoke with few customers over Zoom about the product, not about the product, about the solution that we intend to provide. They told like we can pay 4 times or 5 times this thing if it can satisfy this one condition. So that condition actually we are addressing with our product, but I have not told them, but this is what I was able to get it. So that's the different two. These are two different worlds. So as you told, retailing and this thing, I don't know. It takes some more time, is what my opinion is. But the change should start from our side, right? So we need to start it. We need to start something. So that's what I am thinking. So we need to start from our side. We have this assistive solution. We need to give it, or give it for free or cost cutting. Then people will understand that this is indeed a good solution. Then you can improve. So there are different strategies that we need to come up to basically make sure that these things are actually going to this global this digital marketing premise. So that's what my idea is. So that my opinion, that's purely my opinion actually. And I'm also student in this field of everything. So yeah, everyone can correct me. I'm just a student. So just an opinion. Because there are legends in this meeting. So it's just my opinion. Yeah, that's it.
Thanks, Dhanush. Just in the interest of time, I'm sorry to interrupt the conversation.
That's it. I'm done with that.
Okay. Thanks, Dhanush. In the interest of time, we will quickly present the polls for today, and then we will wrap it up. The poll results for today. Okay, on a scale of 1 to 10, how optimistic you are as an entrepreneur? So 20% of them are 7. They have rated themselves 7. 30% have rated themselves 8, and some of them have rated themselves 10. That's excellent. It's really good to see such optimistic people. Next question. Next. I'd like to interact with someone on marketing, sales, production, legal advice, and investment. Wow. So investment, as expected, has gotten the highest thing, followed by marketing and sales. So we will organize some events and also see if we can get people to interact with. Topics you'd like to have in the upcoming session. So 30% equally distributed between client acquisition technique during pandemic, angels and investors perspective on funding, and startup innovation, and 10% on medical healthcare in future. So that was the results for today. Thank you so much, everybody, for joining us. I'd like to especially thank Professor Ramki, Dhanush, and Praveen for being so actively participating in this session. See you guys again 5 o'clock at Digital Cafe next Friday. Thank you so much.
Thank you.
Thank you.
Thank you.
Yeah, thank you.
Bye.
Thank you.